Hi, I'm Dr. Jazz Gulati.
I'm Dr. John Cowie.
We're two dentists who are really passionate about creating beautiful smiles.
So in our last video about Invisalign, we had an introduction, and in this video, we're going to dive into more depth, and this is for patients who are seriously considering treatment. Both Jazz and myself are both providers of Invisalign, but we've also experienced having Invisalign on our own teeth, and both of us, when we were younger, had the train track brackets and wires braces as well. So we feel as if we've gone through the experience, so we know what it's like for patients to go through the experience as well. As we had a look at in our last video, Invisalign uses a series of clear aligners that gradually straighten your teeth. When teeth are not straight, dentists might describe them as being crowded, as being spaced, having flared teeth, or having an open bite. Now, it's quite interesting to find that all of these conditions usually get worse as time goes by. So as you get older, the crowding that you have on your teeth gradually becomes more crowded. And we don't know exactly why that is, but we just accept that it's part of the aging process. This is why it's both simpler and cheaper to straighten your teeth now, rather than leaving it, for example, for another 10 years. Straighter teeth are easier to clean with your toothbrush. Straighter teeth can also make it easier to bite together and to chew food. Though actually, I'm not sure it's worth doing Invisalign just for those reasons alone. And I think that if you're going to do Invisalign, the reason that it should be for is because you want to make your teeth look nice. For me, even as a dentist, it took me years of wanting to straighten my teeth. But then when I eventually did, I was really chuffed with the results, genuinely really happy. And every morning when I look in the mirror, still, I'm really happy that I did it. And for me, the straightening was really worth it. If you do want to go ahead with the first steps of Invisalign, then what we'll want to do is to take some x-rays of your teeth to double check that they are indeed suitable for treatment. We'll take a digital scan or some molds of your teeth to capture the shape. And we'll also take a series of photographs. Now, the photographs will help us to choose what kind of movements are going to be safe and suitable for your teeth and gums. But we'll also take some photographs of your smile and your face, so we can choose what kind of movements will look good within your smile and your lips and your individual face. Now, as professionals, we know what we think a good-looking smile looks like. And actually, that's based on some scientific research on smile design. So the research done on smiles involved having thousands of images shown to normal people, and the normal people look at the different smiles and they say what they think looks good. The researchers were then able to look at the little technical details of smiles and work out all the little technical aspects that people like within a smile. So we know all the little details of what people think looks good, and we'll advise you on what they are. But actually, the most important opinion is your opinion. So I have lots of different patients in my chair. They might have very similar teeth, but different patients will notice completely different problems about those teeth. So the most important thing is for you to let us know what you notice around your teeth and what you'd like to try and fix. And once we aim to fix that as a priority, we can then add what we think we should do as well. And we can show you other movements and suggest ways of getting the perfect smile, ideally.
Before your appointment where we actually discussed your 3D plan with you, you would have had an email with your 3D plan inside. So it gives you a time to think about any questions that you may have. But usually patients are quite happy with the plan that you present and you're ready to start your Invisalign journey.
The next stage is what we call the fit appointment. So this is where the aligners are fitted around your teeth. Also at the fit appointment, we'll put attachments on your teeth. Attachments are little blobs of tooth-coloured filling material that are put on certain different teeth, and they stay on your teeth all the way through Invisalign treatment, and then at the end of treatment, they're removed. Now, the shapes of these attachments are designed to help the aligners push the teeth in the individual direction that that tooth needs. So different treatment plans will require different attachments on different teeth, and it will be completely individual to your case, and they stay on your teeth throughout treatment. Now, the most common problem we see with tooth position is some degree of crowding. So if your teeth are crowded, it's because there's not enough room for them to fit in the normal arch where we want them to be. And so when they lose space and there's not enough room for them, the teeth get pushed out of the arch, they get overlapped, and they get rotated. So in order to correct that and to straighten your teeth, we need to create space. So one of the ways that we create space is by polishing in between the teeth and actually polishing away some of the enamel of the tooth where the tooth is at its most thick and where it's in a triangular corner. So we're removing the least amount of tooth and the least amount of enamel. Now, sometimes in treatment plans, teeth don't need this at all. Sometimes a few teeth need it, sometimes quite a few of them do. It depends on treatment plan to treatment plan, and we can vary what we want to do to teeth. But if your teeth do need some polishing in between the teeth, the most we would do is 1/4 millimeter per side of tooth surface, and the least we would do would be about 1/10 millimeter. Now, when I had this done on my own teeth, I'll admit I was a little bit daunted at having it, but afterwards I've realised it's fine. It's really not too bad of an experience, and it's something that's well researched, and we know that there are no negative health consequences as long as we polish within the safe parameters that we do.
As well as polishing, there are two other ways in which we can make space. One is by expanding the jaws. This is only possible if your gums and your teeth allow it to be, but if it is, then it really creates that nice, harmonious, broad and full smile, which is kind of American and actually looks really nice. The other way to create space is by having teeth removed. Now, nowadays, a lot of the teeth straightening we can do can be done without having to remove teeth, and this is often the preference of our patients. If you are having teeth removed, you expect your treatment time to be a lot longer. So when it comes to your Invisalign fit appointment, it's usually an hour long. Now, we like to book this time so it gives us enough time to teach you how to wear the aligners, how to remove them, how to look after your aligners, and we teach you a few secret tips on how to get the best out of your aligners, i.e. the quickest time possible and the best results. At that appointment, we also add on your attachments if you have attachments, and we can also sometimes do the teeth polishing in between your teeth. The beauty of the Invisalign system is that we can defer or carry out the polishing more gradually in the coming appointments. And usually the appointments are every 4 to 6 weeks. In that time, you'll be changing the aligners as you go along, around about once a week. Now, the most uncomfortable part of your Invisalign journey is the first few weeks. You're new to the aligners, you're learning how to insert them, remove them, but you get used to that very quickly. But the other thing worth mentioning is you get a little bit of tenderness. No pain, no gain, but it's nowhere near as much as fixed braces. I've had it. I know how painful braces can be with the stiff wires and the brackets, but when I had Invisalign, it just felt more gentle. So there is a bit of discomfort initially. Teeth can feel a little bit tender, but after a few days, it really is not noticeable. And the more aligners you have, the more your teeth get used to moving and the less pain you feel. It's really important that you know about something called additional aligners. Additional aligners is basically, once you've finished your Invisalign, you may think, great, I'm done, my teeth are straight now. But actually you'll see that where your teeth have moved and twisted, they may not be 100% where we want them to be and where you want them to be. That's why we need additional aligners. And this is something that's probably utilized around about 70-75% of the time. Most of our patients need additional aligners, and it's just part of the process. So it's important you know that once you've had the first batch of aligners, you probably need a second batch, and they're called additional aligners. Now, here at Triangle Dental, we don't charge for any additional aligners because we think it's part of the process and we want you to get the best smile possible. It's always better to assume that you will need additional aligners. However, some patients do get lucky, and in the first run, the first batch of aligners, they have their teeth as they want them. Now, there's more to a beautiful smile than just having straight teeth. We also look at the form and the shape of the teeth. Now, by the form, I want the teeth to be white because a white smile means it's a clean smile. And it's a very attractive thing to have a nice white smile. Something that's naturally white is easy to achieve with teeth whitening, which is very safe for your teeth. Now, here at Triangle Dental, we include teeth whitening as part of our Invisalign process. And it's very simple to do, and as you're straightening your teeth, you could be getting your teeth whiter in an efficient way. The other thing we look at is the shape of your teeth. If your teeth are worn or sharp, then just a bit of smoothing can make a big difference to your smile. And if your chips are bigger in your teeth, then sometimes you need something called composite edge bonding. This is a procedure where we add invisible teeth-colored fillings to restore the natural shape of your teeth. Then at the end of the process, you have that beautiful smile. And we'll show you some examples on the screen, as you can see. There is an additional fee for composite bonding, but we tell you that up front so you know exactly what to expect throughout the process.
Finally, let's talk about retainers. So after your teeth have been made straight, they will naturally want to go back to where they came from. This is what we call relapsing, and we don't want your teeth to relapse. We want them to stay in their new straight position. So to keep them straight, we need to retain them there with retainers. Now there are two kinds of retainers. There are removable retainers and fixed retainers. So for removable retainers, this is what one would look like. So this is a standard removable retainer, and we'll give you these at the end of the Invisalign treatment. This is the standard set that we have included, and these are great. These will keep your teeth straight when you wear them at night. It's also possible for an extra fee to upgrade to these premium retainers. So when you have the premium retainers, we actually give you 3 sets of them. And the premium retainers are a bit more sturdy, they're a bit more hard wearing, so they might need to be replaced less often and last more years. And also the shape of them is cut around the gum, so that means that there's less plastic over your gum. There's no plastic over your gum, it just covers the teeth. So we like you to have retainers to keep your teeth straight. For the removable ones, we want you to wear those every night when you sleep. You need to have retainers for as long as you want your teeth to be straight. And so if you want your teeth to be straight for the rest of your life, which I assume you do, then that means that we want to have retainers for the rest of our lives. Another option is to have a fixed retainer. So a fixed retainer is a thin metal wire that is glued to the back of the teeth and it stays there permanently. So that will sit there and hold your teeth straight. When it's first attached and it's first glued on, you can feel it there with your tongue a little bit, and that takes about a week or so of noticing it there with your tongue before it slips away from consciousness. Also with a fixed retainer, you can't floss between your teeth. The metal wire will stop the floss from getting down. That's something to be aware of. It's not a huge problem because there are alternatives to flossing, but that is something to be aware of. But the big benefit of having that fixed retainer is that you don't have to wear your removable retainer quite so often. So the fixed retainer all by itself is almost enough to keep your teeth straight, but not quite. Just to make sure that everything does stay nice and straight, when you have a fixed retainer, we'd like you to have a removable retainer as well. But the big benefit is that you don't have to wear that removable retainer every night. You can wear it a little bit less frequently.
Now, do we recommend having a fixed retainer? Well, for me, it's a no-brainer. I'm definitely quite cautious and I want to have a belts and braces approach to having your teeth straightened for life. 70% of the Invisalign I do is on people who have had straight teeth before and then they stopped wearing their retainer or they lost it or their dog ate it. So by having a fixed retainer, something glued to the back of your teeth can really make a difference and prevent you from becoming a statistic. It is a little bit advantageous for us to know before you start your treatment whether you are planning on having a fixed retainer because it does help us with planning. If you've made it to the end of the videos, well done. You must be quite serious about having an Invisalign treatment. Do check out some of our other videos so you can stay fully informed.